Hi, this is Dr. Susan Brown, Director of the Center for Better Bones. As many of you know, here at the Center for Better Bones, we have been rethinking the nature, causes, and best prevention and treatment of osteoporosis for over 3 decades. Here, one of our favorite motto is, no one cares about your health as much as you do, and you really might consider taking responsibility to thoroughly explore your health concerns to see what options you really have. Today, it's my pleasure to introduce you to a scholar or researcher, a man who has done amazing work helping people understand cancer and even helping them understand their particular cancer diagnosis and what options might be available to them. This is Dr. Ralph Moss of Cancer Decisions. Dr. Moss, thank you very much for being with us.
Thank you.
You know, for many years, I've admired the work of Dr. Ralph Moss. He has written 4 books on cancer. He has an amazing service of exploring dozens of types of cancer in great detail, helping clients understand what this type of cancer is about and what treatments are available, really rethinking cancer and rethinking the treatment of cancer and also rethinking the prevention of cancer. One of the services Dr. Moss has are these reports. They're called Dr. Moss Reports.
Or just Moss Reports.
The Moss Reports. They're called the Moss Reports. And the website is called mossreports.com.
Correct.
Whenever here at the Center for Better Bones, a client comes to us with a bone health concern, but they also have a concern with cancer, I immediately suggest that if they really want to understand what's going on in the world of cancer, and you have to understand, if we think things are changing rapidly around bone health, they're changing much more rapidly around cancer. And to take advantage of an expert who spends his life looking at conventional and alternative cancer treatments, looking at nutrient therapies, these protocols he's going to mention to you have perhaps 100 or 200 pages on nutritional therapies. We send our clients to look at Dr. Moss and his reports. And the second service that Dr. Moss offers is actually individual consultations. Many of my clients, the most recent client, for example, had a diagnosis of one particular type of breast cancer. I suggested she go to Dr. Moss. She read his report, and then she did a consultation, and she was able to obtain a great deal of information that helped her make decisions about her next treatment choices. So Dr. Moss, I welcome you. I have great admiration for you, and you certainly are our go-to person for cancer.
Thank you.
And today I want our group, the Better Bones community, just to know a bit about your work. So tell me a little bit, how did you come to write these, what are they, 39 reports? And I say the last one I saw was 600 pages. You tell us about these reports and the consultations and how they might help individuals who are kind of facing this a cancer diagnosis.
Sure. Well, I've been in the cancer field since 1974, and I did a lot of informal consultations for people with cancer for about 20 years. Not as a business, but because I had written The Cancer Industry and I had written other books on cancer. I think we're up to 12 or 13 books now. A lot of people came to me for consultation, but it became very intrusive, basically, because I was also raising my family, my kids and my grandchildren. So in 1993, after I wrote the book Cancer Therapy, we decided to actually have a consultation service. And this was the origin of what's now mossreports.com. So this enabled me to give people like my full attention for an hour. And initially, we did this actually in person. I was living in Manhattan, and people would come to my apartment house. There was like a room, like a meeting room, and I'd meet. One time, I even took somebody down to a clinic in New Jersey, but of course, that's not very effective in terms of your time management.
Yeah.
So I started then to supplement the physical or the verbal consultation with a write-up about their situation. But again, we kind of stumbled into the business world. This was not my background or that of any of my coworkers. And so I was writing fresh reports for each person. Now, there only were about 25, 26 pages in length, but still, that's hours of work. And then I had the brilliant idea that I could make these, like, get them written and stay writ, as I said, that we make a diagnosis specific report, which of course anybody with business sense would have told you that's the way to go in the first place.
No, but it's only the digital world that allows that, because
Correct.
so every year you adjust these, you update these documents on every type of these.
Right. So the digital world, as you say, was just coming into being at this time. We started the business in about 93 or 92 or 93, at the time that cancer therapy came out. And cancer therapy couldn't have been written without the internet, but we accessed the internet through these very clunky, very expensive interfaces. And then, of course, the web and all the rest of it followed. But the point is that I started to write these reports, and then the more I got into the writing of the reports sort of became the main thing. We have 38 at the moment. We had one time, we had over 100 Moss reports, which wasn't, I had a lot of energy back in those days, 100 reports. But what I found is that there was a lot of overlap among the different reports. And also, it wasn't the writing of the report that was so difficult, because I enjoy exploring unusual situations in cancer or related diseases. It was the maintenance of the reports that was at issue, because now I can maintain 38 reports, but I couldn't maintain 100. And I had a full-time employee helping me with the updates, but again, is it really necessary? Because it's like 1% of my clientele was taking up 99% of my time. So we stuck to the main 38. That's more than 90% of all the cancers.
So it's what I want my clients to, my followers to realize, is that you wrote many books. You say a dozen books, really looking at cancer therapy, everything from questioning chemotherapy to looking at the cancer industry, to this whole question of even herbs for cancer. 12 books. And then you brought that to the public by doing these reports. The reports are so massive, and now there's 39 of them on 39 different types of cancer. And what do you try to cover in the report, Dr. Moss?
So there is the first section of the report is the one that is specific to that particular kind of cancer.
Right.
Essentially, what that's doing is interpreting the current status of conventional therapy for the lay person, for the although we have lots of professionals who also buy and use the reports, but essentially we feel that any person who has the level of a junior in high school is able to understand and digest our
So the first part is the conventional, what they might have heard, an explanation more of what their doctors might have told them about their diagnosis or their...
Yes. So that's important, because there's a fair amount of misdiagnosis in cancer, and also not everybody agrees on what the proper treatment is of even within the realm of surgery, radiation, and chemotherapy. There are disagreements, and my prejudice, as it were, is towards more conservative treatment. In other words, I know what I would want for myself and what I do want for myself, because I've also gone through the process of being diagnosed and treated for cancer. But I'm always looking to sort of cheat the system, in the sense that I want to get the maximum benefit out of the conventional treatments when appropriate, but I also want to have the least damage. That would seem to be common sense, right? But it isn't necessarily how doctors think. Doctors are very interested in squeezing the last 1/10 of a percentage point out of the survival statistics, and quality of life tends to take very much a back seat in terms of decision making. And a lot of people whom I talk to of course, they want to live, they want to be cured if possible, they want their life to be extended whenever possible. But the quality of life is also very important. And as I say, having been treated for very aggressive prostate cancer myself, I know that my decision making was very much influenced by what the quality of my life going
Right.
forward would be. And so this is an important consideration. And I'm always looking, I don't want to say cheat the system, but you know what, I'm sure listeners will know what I'm talking about. Try to get the most bang for the buck. But at especially as you advance in age, getting that last tenth of a percentage point of survival in such as you see in a clinical trial may not be the only important thing. What's your quality of life going to be like going forward? And so this is
and let me interrupt. Let me just interrupt you, because one of the most important things I find about your work is you help people understand the clinical trials that are very confusing and very difficult to sort out, where the assumption may be, oh, this drug is going to be of benefit. And when you look at the trial, it's, 10 days more benefit or something like that at a terrific cost and a terrific risk. So I think people should be aware that you have dedicated yourself to understanding these trials and explaining them in a way that can help people make decisions about their treatment.
Yes. And our approach is a critical approach. That doesn't mean a negative approach,
Right.
but we are critical. We examine the evidence and the database for everything. That includes the so-called alternative or complementary treatments and the conventional treatments. I think that's only fair. I am not a team player. I'm not gonna promote so-called alternative treatments. My approach is integrative, and it was so before that became a popular cliche. I really believe, and I've proven it with my own behavior vis-a-vis my own cancer, that the best way to approach this is to squeeze every last benefit out of the conventional therapies and then use the complementary therapies as an adjunct or additive to what's good in the conventional treatment.
Exactly. So the first part of any of these reports deals with conventional therapy, how to really understand them, how to look at the trials to get the maximum benefit. And then you move on to alternative therapies?
And I move on to the alternatives, which would include the question of diet, which is the most fraught, debated question probably in medicine and certainly in oncology. Question of antioxidants. Mm-hmm. I know you've written and discussed with your own viewers.
Right.
And I've had some writings and discussions, of course, over the years on that topic. I've written some journal articles on that topic. And then what are the innovative forms of treatment that sort of exist in the gray zone, the area between what is conventionally accepted and practiced, and what is scientifically known but not yet fully utilized. And that would be, as an example, and I can't go into all of them, but as an example would be what I call non-ionizing forms of radiation, by which I mean not X-rays or radium, but light in heat and radio waves and photodynamic light, photodynamic therapy,
yes.
photodynamic therapy. So what are we really, can we utilize these? Where could you get these treatments done? Who are the leading people around the US and around the world doing this? And I must say I've expended a great deal of energy exploring these, in the sense that I've gone all around the world I haven't even added up the number of countries, but like in Germany, where hypothermia or heat therapy is very, very popular. Maybe I counted at one time 125 clinics using heat therapy or hypothermia in Germany, and there's probably many more than that. But basically, I made 18 trips to Germany in order to verify and validate and judge and critique the different places that are giving this kind of treatment. I've been keynote speaker at the International Clinical Hypothermia Society meeting in China. So I've had a big involvement with hypothermia, which I think is a good additive treatment to many other treatments. It's not a standalone treatment, but it is a good additive treatment. And I bring that up as one example. Uh,
Right.
I'm fascinated by the international scope of cancer because, um, as a sociologist and anthropologist, and you understand this better than anyone, that the astonishing fact that as you go from country to country, what's considered to be orthodox in one country is heresy in another, and vice versa. And I thought this was so amazing. When I first went to Germany, which was 1995 or 96, I felt like I had landed in another planet because many of the things that we consider alternative, or that the medical profession considers alternative in the US, are completely conventional in Germany. And even walking into a German drugstore is a mind-boggling experience because you feel more like you're in some kind of futuristic health food store slash drugstore. Because if like I remember one time my wife cut her hand and we wound up in a German drugstore, and it's like all the recommendation would be more like what you would be told if you went to a naturopath in the US. The things that are going to be, or if you have a headache or something, the first line of defense is botanical or homeopathic. This is pretty, and France to a certain degree also with the homeopathy, but not with the full naturopathic medicine. So you have alternate related medical systems going on, but the spectrum has sort of shifted to the left, as it were, in a country like Germany, and to a certain degree in the other German-speaking countries as well.
And one of the things I really appreciate about your reports is you help sort out for any individual situation, not only the possibility of alternative therapies, but where people might be able to receive these alternative therapies if it seems appropriate.
Correct.
And it was in the recent report I saw, I was very amazed at your incorporation of new data on China.
Yeah.
From a bone health point of view, the biggest research is coming out of China. They're just getting so serious about all this. And it's amazing that you have the capacity to look all over the world and say, look, this treatment really looks great for this type of cancer, or that has really kind of an interesting success record, and that kind of cross-cultural comparative thing.
And now we've sort of expanded that. We're in the midst of expanding that because both my son Ben and my grandson Jacob are now involved in as partner. Ben's my partner in my mossreports.com website and company. And Jacob went this summer and did the interviews that I would normally do in Germany. And he's a videographer, so he was able to go around and video. And we will put these up on our website pretty soon. So going to clinic to clinic to clinic, as I've done for over 20 years, now I have a little help in doing that.
That's terrific. And just to remind people at this stage, so mossreports.com is where they can go find the information of the work you're doing, the availability of the reports, and also the availability of the consultations we'll talk about in a second. So, and the books, how many books did you say now? 12 books?
I kind of lost count. I have a new book coming out, which will blow the lid off the whole cancer industry. My first book was Cancer Syndrome, or renamed Cancer Industry. And it was about the economic and political underpinnings of the burgeoning field of cancer treatment. But now, literally 40 years later, I'm revisiting that issue. And of course, it's like the cancer industry back then was like a little hovel compared to a skyscraper today. And many things have happened in this whole field that are really mind-boggling. So I'm very excited about this new book.
Yes, and everyone should keep that in mind. That's going to be called, again, The Cancer Industry. What's the exact title of it?
Well, we have some different titles in mind, but if they sign up at mossreports.com for our newsletters and announcements, they'll definitely get a notice when that's available. And
and everyone remember, you can sign up for Dr. Moss's newsletter, which is very informative. Like, one of the fascinating things I learned from the newsletter some time ago was about parsley. that parsley has been found to have great anti-cancer effects, I guess with the apigean in it, and just a few tablespoons of parsley a day can make a difference.
Yes, and dried parsley actually has the most apigenin of any food, any commonly eaten food. So I do most of the cooking in our family, which has kept me happily married for 50 odd years. So I keep a big container of dried parsley, and in the warmer months, I also have parsley growing in the garden along with the other herbs. So it's very interesting that you can promote your own health through foods and so forth. Whether you're going to make a big impact on cancer with that alone, we don't know, because there's no money, not enough money in these type of studies to be able to answer that question. But it can't hurt, and it certainly, if you go look at the laboratory research, it's very impressive.
And it's just like bone health. There's many, many factors that contribute to it. And so we need to cast a broad of net as we can. And certainly this is one thing I enjoyed about your newsletter, is that you give us little tips. And so I suggest everyone sign up, go to mossreports.com, sign up for the newsletter. And maybe at another time, Dr. Moss and I will chat a bit about some of the things he's learned about foods that are especially helpful. And I see a big link between the foods that help build immunity and the foods that help to build strong bones. But right now, Dr. Moss, tell us a little bit about your individual consultations.
Right.
That's how I best got to know you, actually, is sending clients to you for individual consultations. I was terrifically impressed. I remember distinctly one client, a dear friend of mine, had a breast cancer. You reviewed her whole case and said, look, in your situation, you're going to die of something else before that breast cancer. It's not a dramatic kind of thing. You gave her, you discussed the conventional therapies, what were possibilities. And I've seen other cases where you say, you really should think about that the conventional therapies aren't getting such great results. You should maybe think about some of these European and alternative therapies. So tell us a little bit about those reports.
Right. So as I said, this is sort of how my business began, was doing the consultations, and people can sign up for a 1-hour phone consultation at our website at mossreports.com. And then I get some information from them, and we have they can schedule the time. Actually, we have an interactive calendar, which is very nice. And then we get to have a very in-depth conversation about their particular situation, because even though we have these 38 book-sized reports on different diagnoses, everybody's different. And that's not just a sort of a cliche. It is a fact that you never see two people ever the same. There's sometimes small, but sometimes vast differences among cases. And then there also are a lot of people who, in effect, fall through the cracks of the system because they have rare cancers or rare subtypes of more common cancers, which can have their own peculiarities to them. And so I may know a lot about that situation, or I can do the research on that situation, because I'm a super good researcher, as you could imagine. After 45 years, this is second nature to me. And people are, even when I was a beginner at Memorial Sloan Kettering, people noticed that people I wrote about noticed that I had a peculiar aptitude for asking the right question about a treatment. So I think I have some aptitude in that area. So I can oftentimes drill down into the person's situation, but it isn't so straightforward, because you take the case of breast cancer, which certainly constitutes a big portion of the consultations that I do. Sometimes I find myself arguing that the person doesn't really need the aggressive kind of cancer, kind of treatment that is being recommended to them. Sometimes actually the recommendation falls outside the guidelines, or the doctor is choosing the most aggressive of the possible guideline treatments, because sometimes there's a spectrum of choices available to the doctor. And the guidelines are written by the leading experts in the US, the so-called National Comprehensive Cancer Network, NCCN, sets the standard for what's a acceptable treatment. But even within that realm of the acceptable treatments, there are important nuances. So for instance, for my prostate cancer, the acceptable, I mean, the common treatment would have been surgery or radiation therapy, or a combination of those two, and maybe probably hormonal therapy. But hidden away within that, within that bigger picture, the FDA had approved cryoablation. Cryoablation is not radiation, it is cold therapy. And there is a way to insert a probe that is ultra cold temperature.
Yes, yes.
And that does two things. One is it destroys the tumor without necessarily harming any of the surrounding area. Doesn't cause cancer the way radiation can do. Radiation is called a complete carcinogen because it can start and promote the growth of cancer. So I didn't want that. And it also has very favorable effects in terms of the after effects. I won't get too graphic, but the after effects of the treatment. So you wind up with more normal functioning.
And that was a treatment you were able to get right here in the United States.
I absolutely did. And I won't go into my whole story because I've written a whole article about that, about my own experience with cancer, some of which was horrendous and some of which was fantastically good. So people can look for that on the web. It was published in Townsend Letter and it's pretty widely available. Morse Reports, I think.
Morse Reports, okay.
Copy of that, right? MorseReports.com. But the point is that sometimes, you can dodge the bullet, or at least partially dodge it enough so you're left with a good quality of life. And this was, of course, came after more than 40 years of experience counseling others, but I was in that situation of, having to then apply what I had learned to my own situation, which of course is like when Dorothy wakes up and everything's suddenly in color, it's a horse of a different color, literally.
Yes, exactly.
Yourself, but luckily for me, I just passed my 4-year mark without any sign of any progression or recurrence of the cancer. So I applied, for myself, the same kind of analysis of the data that I would apply to any other person. That's part of what sometimes I wind up being the advocate for a more conventional approach. I had this recently. Somebody wanted to come to me. They had decided in advance that they were not going to do conventional therapy for this lady's breast cancer, but they were going to go to a particular clinic in Mexico instead that had kind of entranced them with fantastic advertising and promotion that was going on. They wound up deciding not to do that. They wound up deciding to go to a stateside clinic that with great experience with cancer that combined conventional with complementary treatment. So, I don't force my views on other people.
Sure.
Not my role. I don't do that with anybody actually, but I certainly don't see that as my role as an advisor and a counselor. I basically give them an informed picture of what they're facing. And it turned out that with this particular lady, that the cancer she had was more dangerous than she realized, and the benefit of conventional therapy was much greater than she realized. So she was being misguided, I would say, by people who had a commercial interest in her taking a particular pathway. She was being misguided to do this quote unquote alternative, which is an unproven thing. Whereas we have data to show what happens within clinical trials in particular, but also sometimes in the more general population by doing the more conventional treatment. And that made sense to them. But the point I wanted to make was, Susan, that I refused to do the consultation as long as they set the boundaries and said, just tell us about the alternatives and don't burden us with any talk about the conventional. I said, you'll have to really look elsewhere, because I won't fight with one arm tied behind my back. I don't want to do that. it would be, I said, if you had a recurrence and her chance of a recurrence without doing some of the conventional things was fairly great, more than 50%, I would say. I don't want that on my conscience, that I agreed to do this consultation and I didn't at least inform you
Right.
of what the actual situation was. And so that sets me apart from almost everybody else who's doing advising cancer patients, because I don't have a dog in the fight in the sense that I'm going to profit by you choosing one thing or another thing, or one clinic or another clinic. That doesn't affect me whatsoever. It's immaterial to me. I want you to get the best advice, and then you'll make up your own mind about what the best treatment should be. Now, if you ask me, and it's the most common question I hear, what would you do if you were in my situation? I mean, of course, I don't know what I would do if I were in yours. I'm not you, and I don't know what I would do. And in fact, to a certain degree, you don't even know yourself what you would do when confronted with it, which I discovered when I was diagnosed with cancer myself. But I can tell people, well, I've been put to the test, so I know what I would do. I would choose to squeeze the greatest benefit out of the conventional or the guideline type of therapy, and I would do other complementary things following that I think would be the greatest benefit. So what would that be? Well, the thing that I relied on most when I was post procedure, after my cancer had been destroyed by the cold probes, the cryo ablation as they call it, was green tea. So to me, the data for green tea, the effectiveness of green tea, whether as a drink or as a supplement, was the most compelling. And I took this basically like around the clock for a year after doing the procedure. Do I think that green tea, quote unquote, cured me of my prostate cancer? I would never say that. If anything cured me, it was the cryo ablation. And of course, when you've had cancer, you basically hold your breath that it won't come back. But as I say, 4 years have gone by now for me. And in my heart, I credit these supplements as having been beneficial. I also brought my blood sugar under control, which was definitely in the type 2 diabetes range. And I had to make sure that my blood sugar was, well, I've been able to control my blood sugar through diet, which means a low carb diet. It was a ketogenic diet initially. I don't check my ketones anymore, but I keep to a low carb diet. So my amount of grain intake, for instance, might be half of a cracker a day. That would be my typical grain intake, just to get some B vitamins in.
It's really interesting, and maybe I would encourage my clients to go look at your situation. After 40 years of research, you develop a cancer and you apply some of the principles. And now I hear you saying that kind of while you spent your life looking at therapies in this country, around the world, that it's a good idea to understand what conventional therapy has to offer, look at the ins and outs, look at the trials, really try to sort out what is the most effective approach, and then look at the other therapies. There may be some place in the world that has a better treatment for this, and I've heard you suggest that to clients at different times, where they actually do their own trials, where they actually have data. And then, so that's what you do in the consultations. Plus the consultation books I've seen have many, probably a couple hundred pages on nutrition. And maybe at another time we can talk about this green tea, which I have heard you say that actually is effective at impacting the cancer stem cells, and it's a whole new kind of very progressive therapy where you need lots of this green tea component. That would be a very interesting thing to look at. We are very big at the use of ascorbate, buffered vitamin C. That also has some new breakthroughs, I understand, in cancer treatment. So, and all of those apply for maintaining well-being as a part of the picture, just to keep your immunity boosted up. So,
and we don't know where we have a lot of information about the preventative effects of food, of nutraceuticals and foods in terms of the prevention of cancer, whether it's primary prevention to never get cancer in the first place, or secondary prevention after you've already been treated.
Mhm.
But that doesn't answer the question of whether nutraceuticals will interfere with conventional cancer treatment. And it's an open question. I don't have a dogmatic position on this. What I have written, I wrote a book called Antioxidants Against Cancer, which is mostly about the preventive effects of antioxidants. But when it comes to the question of will antioxidants or supplements in general interfere with conventional therapy, I'm waiting to see the clinical study showing that it does, because I don't see that. And I have written this for 20 years. When I gave the Grand Rounds lecture in the Department of Surgery at Memorial Sloan Kettering in 1999, this was the basis of my topic of my speech to the surgeons. Why don't you do the study that'll show whether or not antioxidants actually interfere with the application of conventional treatments? They've never done that. So I take any statements that are made about the supposed ability of antioxidants to interfere with chemotherapy with a grain of salt, because we don't know that. We know that they're on a theoretical level, or even on a cellular level, there are some ways in which antioxidants could interfere with the pro-oxidant effect of many treatments. That doesn't mean necessarily, though, that the patients are going to do worse and if they take antioxidants. And I have some data to show that they'll actually do as well or better. There's certainly no dramatic decrease in survival based on the very few studies we have. There's no dramatic impact actually either way by adding in the antioxidant. But the antioxidants may decrease the toxicity of the treatment. This seems to be the case. And if you decrease the toxicity of the treatment, even if on a cellular level there's a contradiction between the antioxidant and the pro-oxidants of the treatment, you still could get a beneficial effect. Right. Because a lot of people drop out of treatment regimens because of the toxicity of the treatment, depending on the drug and the kind of cancer, but it's a common situation. If you can keep the patient in the program longer by giving a milder form of treatment, or giving agents that would moderate the toxicity of the treatment, you may actually come up with a better effect. Because, and this is proven at Columbia University in a study of kids and their antioxidant status, that the people with the higher antioxidant levels, the kids with the higher who were getting the antioxidants, got more chemo, and they therefore did better. So the chemotherapists who argue, oh no, you mustn't have any antioxidants, you're going to interfere with the treatment, don't take into effect the real world effect of the chemotherapy, which is it's too toxic for most people. And therefore, if you give something that minimizes the toxicity, even if, and I'm repeating myself, but even if it somewhat decreased the cell killing effect of the drug, could still come out with a better outcome. And as I say, there's evidence to show this is the case. So don't argue to me based on what happened in a test tube, because test tubes are not human beings. Don't even argue based upon what happened in an animal, because or a lab animal, because that's an artificial construct. What happens in the human situation is most convincing, and we don't have good clinical trials that would answer that question for us.
That's the same thing we find with bone health, that you have to deal with the human studies. So, Dr. Moss, I want to thank you very much for giving us this time today. To all of you out there in the Better Bones community, remember, if you want to take a deep dive in kind of understanding the whole history of the cancer industry it is today, your particular type of cancer, what options and how you might best squeeze the last little bit of benefit out of conventional treatments, and then what the alternative treatments might have for you, I suggest you look to the resources of Dr. Ralph Moss. He is our go-to person for cancer here at the Center for Better Bones. It's ralphmoss.com. probably a dozen books.
Mossreports.com.
Oh, the email is, the website is mossreports.com. We'll have all of the information on the protocols of the different types of cancer, the reports that you can purchase, and the consultations, as well as information on the dozen or so books that Dr. Moss has and his new book coming up. I encourage each of you to take responsibility and to enjoy the benefits of someone who spent his life really from a public interest point of view. And that's what I appreciate. You really have a public interest point of view. What can we know about cancer? How can we help? How can we help the public make better decisions? I appreciate that. I congratulate you on your work, and I thank you for giving us so much time.
Well, thank you, Susan. Pleasure as always. And I hope to speak to you.
And we'll talk soon. Maybe we'll talk about some of those foods and some of the things that you found effective.
Thank you. Will do. Bye.
Bye-bye.